going to be your nurse tonight, okay? Just give me 1 second while I wash my hands and get some gloves and we'll get started, okay? Alright. Okay, great. Could you give me your full name and date of birth for me?
Danielle Ferrucci, 08/27/1998.
Okay, perfect. And I'm just going to check your wristband, make sure that matches. Great. And while I'm here, I'm going to check your MRN too as well. Okay, matches. Great. I'm going to go over your allergies with you, okay? Do you have any allergies to medication?
No.
Any allergies to environment?
No.
Any tape allergies?
No.
Latex?
No.
Food allergies?
No.
No? Okay, and that matches here, so that everything there looks great. And then I'm just going to go over your vital signs with you as well, okay? Alright. Results. Your blood pressure was 118/62, heart rate 68, respiration 17, oxygen saturation was 99, and temperature was 98.7. So those are all within normal limits. Everything looks great there, okay? So, do you have any pain today?
Just some head pain.
Okay, when did your pain start?
About like 3 days ago.
Okay, and then where in your head is it located?
More like frontal.
Okay, and then when you get this pain, how long does it usually last for?
It hasn't gone away in the last few days, so I would say it's constant, yeah.
Alrighty, and then what does your pain feel like?
It's just like a lot of pressure.
Okay, and then is there anything that makes your pain worse?
Just at the end of the day, like after like all school and everything, it's just,
Long day?
Yeah.
Anything that makes your pain better?
I take Tylenol.
Okay, and then is that the only treatment or anything that you have for your
Yeah.
pain? Alright, and if you had to rate it on a scale of 1 to 10, 10 being the most severe, what would you rate it?
Like a 6.
6? Okay, well, glad we came in. Alright, so moving on, I'm just gonna make sure you're oriented, okay? So do you know where you are today?
Yeah, the hospital.
Okay, and then do you know what day it is?
February 5th, 2021.
Okay, perfect. So, and patient knows who she is, so patient is alert and oriented ×3. And then, can you put your arms out for me? Okay, body is symmetrical, and she seems to be in no apparent signs of distress, so everything looks good there, okay? Alrighty, moving on, I'm going to check your drains, okay? I'm going to check your nasal cannula here. Will you just pull down your mask for me? Perfect, no breakdown. I'm going to check behind each ear. Great, no breakdown there. I'm going to check the tubing all the way to the wall, just for any kinks. It looks good. You're on 2 liters of oxygen, which matches what I have here in my chart, so great there. I'm going to check your IV site, okay? Alrighty, any tenderness?
No.
No, okay, and no erythema or edema, so everything looks good. I'm going to check the tubing, make sure there's no kinks. Okay, great. You're getting 0.9 sodium chloride, which matches what I have here in my chart, so great. I do not see a Foley catheter, but if I did, I would assess one accordingly, okay? Alrighty, moving on, I'm going to take a look at your hair, okay? Okay, perfect. Hair distribution is even. No lesions or any breakdown. Everything looks good there. I'm going to check out your skin, okay? Do you have any wounds that you know about?
No.
No, okay. So no wounds, no breakdown or bruising at all. There is no edema in any of the extremities. Skin is warm to the touch bilaterally, and skin is color is normal for ethnicity. Okay, and then I'm going to check your skin turgor. Perfect. And then can I see each finger? And then each toe. Okay, perfect. And the cap refill is less than 3 seconds in all areas, so everything checks out there. Moving on, I'm just going to do a quick assessment of your ears and your eyes and nose, all that stuff. So I'm going to take a look at your ears first, okay? Alright. Perfect. No breakdown or lesions, no obvious drainage. Same for the other ear, everything looks good there. Will you just pull down your mask for me? Okay, I'm going to take a look at your nose. Perfect. No lesions, no redness. Nice and pink in there. I'm going to do a quick assessment of your eyes, okay? You can put your mask back up. Alright, will you just separate your face like this? Okay, so I'm going to shine some light in your eyes, okay? Twice in each eye. Same for the other eye. Okay, you can, and then I'm going to have you follow my pen light, okay? Okay, so pupils are equal, round, reactive to light, and reactive to accommodation. So everything looks good there. And I'm just going to take a look at your mouth. So just lower your mask one more time. All right, open up. All right, area is nice and pink, no redness or sores. Uvula rises to midline. And then just smile for me. Okay, perfect. And then facial symmetry looks good. Smile was even. And then sclera was also white. And then conjunctiva was nice and pink and moist as well. So looks good. Alrighty, so moving on, I'm going to do an assessment of your lungs, okay? Alrighty, so yeah, if you want to sit up on the side of the bed, not your first time, huh?
Yeah.
Alrighty. Are you having any trouble breathing today?
No.
Okay, perfect. So breathing looks good. It's non-labored. Patient does not seem to be using accessory muscle use, so everything looks good there. I'm gonna take a quick listen. Whenever you hear whenever you feel my stethoscope move, just go ahead and take a deep breath in and out. Okay.
Okay.
Alrighty. And then for the video purposes, I'm gonna listen over your shirt, but normally I would listen on the skin. Okay. Perfect.
It's not a date. So back your hand. So I'm going to listen to the 5 different cordial.
Alrighty, breath sounds are good. Equal bilaterally. No advantageous sounds heard. So everything sounds good there. If I did have an incentive spirometer, I would teach my patient how to use one and then have them demonstrate their use to me. Okay. Alrighty. And then next part, I'm just gonna go ahead and do an assessment of your heart. Okay. So first things first, I'm gonna palpate your carotid. Okay. Okay, perfect. No thrills were noted. And then I'm gonna feel your radial pulses. Okay, great. And then your pedal pulses. Alrighty, everything feels good there. +2 in all areas. Rate was good bilaterally. And then moving on, I'm gonna go ahead and listen to your heart. Okay. All right. So I'm gonna listen to your 5 points of the heart. I'm gonna listen to your aortic on the right sternal border, the second intercostal space. Move on to the pulmonic, left sternal border, second intercostal space. Move down to the Erb's point, and which is the left sternal border, third intercostal space, and then move down to the tricuspid, which is the left sternal border, fourth intercostal space, and then your mitral, which is going to be the left sternal border, midclavicular line. Okay. All right. And I'm going to do this twice, each with my diaphragm and then my bell. Okay.
I have very good luck with technologies. The last that video, like it was uploading up to the last hour. I was like,
Yay! Okay.
and then I used the YouTube link.
I would start with
And then one time right under here. Okay.
we're all listening, right?
While I'm here, I'm just going to palpate it as well.
Midclavicular line.
Okay, perfect. And then same thing with my bell.
Okay. So, right sternal border, second intercostal space,
I will be so proud
and
of
I will
myself.
go to the pulmonic valve, which is second intercostal
Because then my boyfriend is so happy that he doesn't have to participate.
Okay. Perfect. S1 and S2 were heard in all areas. Rate and rhythm sound good. No extra sounds were heard. Everything sounds good there. And then lastly, I'm just gonna do, oh, before I forget, I'm actually gonna listen to your carotid as well.
Yeah, mine was only one that's because I guess it's, if you think about it, it's like right in the middle, your palpable here, right in the middle.
Alrighty, and then that sums up my assessment of your heart, okay? And then I'm just gonna check your extremities out, okay? So are you experiencing any numbness, tingling, or anything else in any of your extremities? Alrighty, so I'm gonna have you grip my hands, okay, as hard as you can. Alright, and then pull me towards you. Okay, push me away. Great, and then check out your legs here. So go ahead and bring your feet towards your body, great. And then go ahead and press the gas. Okay, great. So your strength in all your extremities is a +5 in all areas, which is great. Doesn't get much better than that. So that ends up our assessment today. You can go ahead and take a lay back down. Alright, great. So here's your call light. Just if you need anything, you just press this button. I'm just gonna lower your bed back down. Is there anything I can get you before I go?
No, I'm good.
Alrighty, someone will be back in about an hour to check on you. Okay.
Okay, thank you.
Alrighty.